Good afternoon. I'm delighted to be here with y'all today. I gotta say, I was weary that I was thinking that we wouldn't have that many people left in the day, but y'all are hanging in here. Apparently, a very committed bunch out here at Rutgers. So I want to say, first of all, that it's been really interesting hearing this conversation. It's been about 20 years since I got my PhD in public policy, and I got to tell you, I went to get a PhD in public policy because I just knew that my family in Detroit needed a different life. I didn't know any other way to do it but to figure out how to get an education that I thought would give me enough data and information to understand why my community didn't have the resources it needed, why my family, although they were hard workers, working 2 and 3 jobs, couldn't always keep the lights on, couldn't always hold on to their homes while we were getting foreclosed on and things like that. And I just thought, I got to figure out how to change this. And so I went to get a PhD in public policy, thought that was going to be the ticket. Landed a tenure track position at University of North Carolina and thought this is it. And then like many scholars who are probably in this room asking all the same questions today that I was asking 20 years ago, which is, I don't want to sit here and talk to a bunch of academics. I want to be out in the community doing work that actually serves my communities or communities that look like me. And trying to figure out how to do that at some point just got untenable. And so I left the academy and said, I'm out of here, guys. But I'm happy for the opportunity to do this. I felt like I was making a lot of progress, but it didn't allow enough space to be able to do really good community engaged scholarship in the way that I'm hearing about today. So on the one hand, I am so excited to hear about so much great research and scholarship that is living into the promise of that. It makes me feel like we are making progress in the academy and otherwise. And it also makes me a little bit disheartened to see that we still have so far to go, that some of the basic conversations about how you get tenure and do this work at the same time is like, oh my God, really, people? Like, let's figure this out. So the good news is it sounds to me like at Rutgers there is a real interest in, opportunity in, desire for models of demonstrating what you can do, right, as a scholar who wants to be deeply involved in community. So I will say that I've taken my work out to the private sector. After I left the academy, did some work for the feds for a little while, did a little work in nonprofit organizations, and then eventually led me to start my own business called TheCaseMade, which is really trying to hone a skill set that I think is really critical for those of us who do community engaged scholarship, although most of us don't have it quite yet. And actually, I want to step back a little bit. When I got my PhD, there were 2 things that I wish I had gotten in graduate school that I did not get. The first one was the subject of the last conversation we were just having, and that is fundraising. I remember when I was still a graduate student, I was doing some research at Radcliffe Public Policy Center at Harvard, and a good portion of our time was spent fundraising. And I just remember thinking as an early scholar, why am I doing this? I just want to do my research. I don't want to have to go ask people for money. I didn't sign up for that part. And a mentor of mine at the time at Harvard said to me, darling, the only way you get to do that research is because we're fundraising for it. And I went, oh. And just like that, it was like, oh, okay. But the skill set of that, and I have to say, being at Harvard, where there is just a machine around fundraising, and initially it turned me off. And I think, I didn't sort of get initially that was part of the job, that was part of the gig. But I know all of you at Rutgers, because Rutgers has its own machine, right, get what it requires, not only to raise money for your own research, but the overhead rates that you got, right? Y'all know about that? Y'all know about that? Y'all don't know about overhead rates? I know you do, because the only way you get to do your work, right, is to raise money for your research and all the beautiful surroundings around you, the landscape, the trees, that's what it is about. So one of the things that I wish I had gotten in graduate school, so for those of you who are teaching doctoral students or other folks, is really a good skill set early on around fundraising. How do you do that and integrate it into your scholarship? How do you do that seamlessly so it doesn't feel like it's an add-on after the fact, but people really get to see that it's a part of the work, because otherwise it feels like that. The second thing that I really wanted to be able to get, I wish I had gotten in graduate school, which is a lot of what I do in my professional life right now, which is what I call strategic case making. It's being able to make a case for the thing that you're doing. It's not just about the research that you do, but about having folks join with you to scale it, to uplift it, to give it more support. It's interesting, we were just having this conversation just a second ago about the distinction between all of the things that we know, how we know how to do this work and all these great outcomes. So what's stopping us from scaling? What's stopping us from making that business as usual, right? How do you make the case to build public and political will that all the solutions we think we have in this room are worthy of investment? We don't teach that, and it is a skill set, and you need it. I remember the first time I recognized that as a skill set, one that I had a lot of expertise in after having gotten, and probably many people in this room, by virtue of where you've gotten in your own careers, you've had to develop some skill sets around case making. But let me just give an example of that, and let me just say the reason for which I actually founded my business, TheCaseMade. I was working in DC, this was many years ago, and I had lots of friends at that time who were in the White House doing a whole lot of community engaged scholarship, and folks who were implementing policies. I worked in feds, and I had a lot of friends in the federal government at that time. And so a colleague of mine who's doing some work in violence prevention in her city called me and said, listen, I know the White House is about to drop this new report on really important and innovative community-based solutions to violence prevention, particularly with youth. They haven't reached out to us at all. We've been trying to get an inroad to be highlighted in there. We know that if we could get highlighted by the White House, it would really mean everything in terms of our visibility, would help us get some funding. Can you get me a meeting? Can you just get me somebody to talk to? Because I know they're about to drop that report. I said to her, maybe, right? I don't necessarily, have all the inroads, but let me try. So I did some calling around. And was able to get her an appointment. So I called her back and I said, listen, all right, you got a half an hour. It was a Wednesday. We got Wednesday, 2:30, you're gonna get a half an hour. But I said, let me tell you how this works. On the books, you got a half an hour. In reality, what's gonna happen is they won't call us at 2:30. We're gonna be sitting around until they call us, because that's how it works. When they call us, we'll go into a conference room. A colleague will come in. My colleague at the White House will come in. He'll sit down. You got pretty much about 10, maybe 15 minutes before an aide will knock on the door. And once there's a knock on the door, the aide will ask him if he's ready to go, or if he wants to, what he's got something else to do. Does he want to stay, or does he want to take the next meeting? If he's hearing something he wants to hear, he'll stay. If he's not interested, he's going to get up and thank us and walk out the door. So you got about 10, you got about 15 minutes at most. And so she said, no problem, I got it. Dr. T, I got it. I said, okay. So the day comes, we get to the White House, we do all the things. You got to go through the security, you got to do all the stuff, right? So we go, and like I said, we sit there promptly at 2:15 because we're ready for our 2:30, right? 2:45 goes past, 3 o'clock, 3:30, 3:45, and finally, we get called in to see my colleague in this conference room. We get into the conference room, I exchange pleasantries. Thank you so much for taking this meeting. It's really important. We know that there's all this a scholarship that's coming out. You're about to highlight this in the White House's report. We're really excited about it. I'm excited that I can introduce you to my colleague who's doing some amazing work, right? And so I hand it off, we sit down, and she starts. And she starts really strong, and when we first started doing this work in our city, here's what was happening. We weren't able to get young people really invested in not just, coming out of issues that were causing them to be in deeply violent circumstances, but we also weren't able to help their families. It was really challenging, but because of the work we've been doing, and here's what it looks like, we've been able to do 1, 2, 3, 4. So I'm thinking, okay, this is going really well. And then she starts reciting just a list of the awful things that are happening in the city. And this is happening, and this is happening, and this is happening, and this is happening, and this is happening. And she's going down the list, I think, because she thinks that if she says things are so bad that he'll be interested. And I'm sitting there, and I'm thinking in my head, oh, this is not going in the right direction. And she's going on and on and on. So I felt like I needed to help her redirect. So I gently just kind of put my hand on her arm, and I said, you know what, let's also talk to him about, the impact of what's happening even beyond young folks, and right? And she said, oh, yeah. So she starts up again, and she's going, the impact. And then she goes into the fights that they've been having with the city and the city council about elevating the work, and they can't get the support they need, and I'm thinking in my head, oh, boy, This is not going in the right direction. This is not. And so as I'm trying to figure out how to redirect her in this conversation, what do you think happens? And my heart just sank because I knew that she had not done enough in that meeting to get elevated to what the White House was going to do. And as I thought, the aide comes in, she says, "Oh, you got a meeting?" And he goes, "Yeah, I got to go. We got a lot of stuff to get done." He gets up, we exchange pledge. "Thank you so much. Yeah, send me some information about what y'all are doing. Yeah, da, 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 da." And he walks out of the room. And I just, like that was a real opportunity for her and her program to really have a champion well beyond what was happening in her community. And I just felt that I felt bad because I felt like I had not done enough to help her understand how to position herself vis-a-vis this person in that meeting. And so we got up and we went out into the hallway, and she was so excited. And she said, "Oh, that was really great. I'm so glad we got this meeting. I think he really heard us." And she was so excited. In that moment, I didn't have the heart to tell her, that was not it, right? You're not going to, I just couldn't do it in that meeting. But I made a mental note at that moment that I never wanted to be in that situation again, where I was with a friend or a colleague doing some incredible community-based work in front of somebody who has the power to elevate that, right? To help you get the support you need to do it even bigger and better, and you not be prepared with what you need to make a strong case for what it is you do and why it matters to the person who's sitting in front of you. That was not a conversation about all the things that you have done. It was a conversation about the aspirations of what's happening in the White House and how the program that you do, right, where they have a stake in lifting up, right, what's happening in that, positively in that community. That was really the genesis of the work. It will be many years from there before I actually started The Case Made, but that's essentially what I do with a lot of folks across the country, both at the individual level, helping them craft thoughtful ways of communicating what it is they do and why it matters for all of us, right, and how you build a stronger public will around it. We were just having this conversation in the room just a second ago, and I haven't even started my presentation. I'm so energized by what y'all do. I'm gonna keep going until I feel like I wanna move on to a presentation, because that's what I'm doing today. But we were just having this conversation about whether it would change the conversation if folks could hear all of the different presentations in the room about what's happening and what doulas have and what's happening in terms of health disparities and what's happening in terms of housing. I want to say something to y'all, and I don't mean to offend, but I want to say it in a very provocative way. They're hearing it every day. Are y'all watching the news? Every single day on the news, story after story after story is another conversation about everything that is wrong. The first story will be a story about the housing crisis and what's happening. There isn't a newspaper on any given day in America today that you cannot pick up that's not talking about the challenges of affordable housing and the fact that most of us can't afford where we live. Who's confused about that? There isn't a newspaper in America you can't pick up that's talking about COVID-19 and who's not taking the vaccine, and the very people who need it the most are the folks who are not getting it. There's no trust in... Really? Because hearing that is going to make, right? Think about it. Every story, the next story is of what's happening in our schools, and our kids aren't getting educated, and they're shooting each other and the guns, and oh my God, and the next story is about the Ukraine and what's happening. And then the next, really, every story after story after story is crushing people and their sense of agency in the world. Do y'all get that? And as health providers, I'm gonna say something. I hope this is gonna be, maybe this is gonna be a little too sensitive. If not, maybe I won't get invited next year when y'all do the presentations. It's okay. Bob invited me back this time, so I feel like maybe one more time. But I gotta tell y'all, the health folks, y'all are the worst. Oh my God, there's no sector that can depress a room as fast as y'all can. My Lord. Woo! Who's poor? Who doesn't have access? This many people don't have. This many people are poor. This many people have the chronic disease. This many people. All of that is really important data. And don't get me wrong as an academic. I'm a strong data advocate. That's where I've been trained, and I think we need to understand what the magnitude of the problems are that we're facing so that we can try and solve them. It just stands to reason, though, that's not the thing that makes average, everyday people go, yeah, yeah. Because who gets up in the morning saying, yeah, chronic diabetes, yeah, right? Affordable housing, let me at it. Let me get it, right? It's just, and it's not the issue, it's the way that we're presenting that just crushes folks. That's why folks are not leaning in. When we start to have these kind of conversations, they're not leaning in, they're turning on Netflix. And we know a lot about the social science of persuasion. What we know is that the onslaught of that sort of crisis mentality constantly crushes people's sense of agency. It backfires. It pushes people away from the very thing that we want them to solve rather than toward the issues we desperately need their participation in, right? And I'm not just talking about low-income folks. I'm talking about all of us. We are in desperate need of a different way of engaging folks that doesn't require us to feel like there's no hope for the future. And yet, most of the communication, not just in this academy, but the newspaper, just the onslaught of that. And let me just say, let's just back up. What's the reason why we're presenting our data in this way? What's the reason why we're doing that? Because all of us are trying to get people's attention. We're trying to get their urgency. We're trying to get them to solve this stuff. So we're saying as big numbers as we can. I remember I was working at an affordable housing provider for many years, and we would try to get the biggest number. 40 million people in this country are housing insecure, and da-da-da-da-da. As an average everyday person, you want me to stand up and try to solve for 40 million people? What? I'm trying to get dinner on the table for two kids, two teenagers, right? You want me to take that on? That's what you have for me? I'm going to Netflix. Game of Thrones has got to be better than what y'all are talking about. And so it makes it very difficult, is what I'm saying, for us to have people understand what we're talking about and engage on the issues that we care about, which in turn makes it incredibly difficult for us to solve a whole range of issues that we're lifting up today, whether it's affordable housing or maternal depression or chronic diseases and chronic health issues. It makes it really difficult for us to get people to rally around the things that we know are important. So the work that I do at TheCaseMade, I just rambled on for about 20 minutes. I lost half my time. But that's all right. I'm trying to get back on track. But the work that I do at TheCaseMade really is about helping folks find their way in that conversation, whether it's about lifting up the vantage points of individual programs, like what I was trying to help my friend do at the White House, not very well back in the day, or whether it's really a community of folks trying to lift up affordable housing solutions. And let me just say, even before I get to my presentation, I don't know what's going to happen there, but let me just say, think about it. For most of the issues that we care about, there is majority support for most of the things we're talking about, right? When you do surveys all across this country, when you ask people, should people have more affordable places to live? Should we be investing in affordable housing? Yes! People raise their hands. The majority of our country says yes! When you ask people, should people have access to health care, right, on demand? You feel sick, you're not feeling well, should you have the ability to walk into a hospital, nationalized health? Yes! Yes! Do you think we should be doing more to protect the climate, right? Yes, we should be doing, yes! Overwhelmingly. So why aren't we doing it? If all these folks, when you ask people about their value system, when you ask people their opinions, they raise their hands and they say yes on things like affordable housing. What happens when you say, oh yeah, okay, great, you say yes to affordable housing and now we're going to build it in your neighborhood? I want to ask the question, and I wanted y'all to be honest. I'm totally off script, so let's go with it. I want y'all to be honest. How many of you live in communities today, honest, that if they were to announce, the city, whoever it is, were to announce that they were going to build some affordable housing at the end of your block where you live, how many of you live in neighborhoods where your neighbors would come out in a show of force to oppose that? By a show of hands, how many would live in communities where they would come out in a show of force? A good proportion of this room. Yeah. What's interesting about that is that phenomenon. Like, yeah, I agree with affordable housing, but wait, on my block? In my neighborhood where I live? Wait, right? What's interesting about that phenomenon is we're not only seeing that with respect to high-income communities. So some of y'all may have thought if I live in a ritzy community that is probably the state of play. But we're seeing that attitude in low-income and moderate-income communities too, where folks are saying, I don't want that in my community. I don't want that. Which is really interesting for the first time to start hearing that. And I can tell you why. In fact, there was the Shelter Force magazine, which I'm on the board of, which is the sort of the magazine of housing and community development folks, did an article, and they were talking about Camden. And they were talking, it was kind of one of those WTF articles. Like, for years, community advocates have been asking for more affordable housing, especially around the waterfront of Camden. And they had been talking about that consistently, like, right, really, really pushing on City Council to do something with respect to affordable housing. City Council, right after many years of building up the waterfront, said, okay, all right, we're going to start building affordable housing in neighborhoods across Camden. They announced a set of developments, and the Camden housing advocates went wild protesting the affordable housing. And the City Council went, for years y'all have been asking us to do affordable housing. And now we say we're going to do affordable housing in your neighborhoods. Now we say we're going to do it, and now you don't want it. What in the world is happening here? What's happening is a backfire, right? What many of y'all were talking about today, two things were happening. One, they don't trust that the City Council is building that for them, right? In fact, many of the community residents said that for sure. Y'all are not building this for us. We're not going to be ones that benefit from this. They didn't trust the City Council on that issue. But the second thing is, legitimately, they were concerned about displacement, because their thing was, you're going to build a couple of affordable units of housing in this community, and what's really going to happen is it's going to signal to developers, many of which I think David Trott was talking about earlier, I don't know if he's still here, going to signal to those folks that this is a neighborhood to invest in, because, right, it's getting broader investment. So speculators are going to come, and what's going to happen is we're going to be displaced out of this neighborhood because you haven't done enough to make sure that there are anti-displacement policies in place. So no, we don't want that affordable housing in this neighborhood. City Council went, wow, what in the, like, we are doing all the things we can possibly do just to get these initial developments, and now you say, so what I would say about that is, in the context of public will building and case making, the alignment of a whole lot of folks in community has to be there if we're going to have public and political will around these issues. Okay, that was the introduction. How about that? Let's see how far I get in the presentation that I really came here to give you all in terms of some of these issues. What I want to say more than anything is, while we are very invested in policy and programmatic services, we're invested in solutions that work in the health space, what I also know is that if we are not investing in the skill set around case making, boy, are we doing ourselves and our students such a disservice, because they come out of these institutions and they don't know how to do it. And they end up, right, with policymakers next to them, right, that when they could be saying something really powerful to lift that up, and they don't get the opportunity to do so. It's one of the reasons why I've been sort of, on a mission to proselytize, I guess, around some of these issues that, man, building public and political will is critical. It's not that we don't have people agreeing with the things we're talking about or the solutions that we're building. It's that there are a whole series of impediments to action. I'm nervous. You're going to build that affordable housing in my neighborhood. Well, my property values. This is the only asset I have, and I'm nervous. Wait a minute. I'm nervous, right? I'm afraid. And then there are going to be other kind of people. All kinds of things happen. And so if we aren't thoughtful about how we get in front of that and develop the skill set for getting in front of that stuff, wow, do we get run over by it, right? And especially, I would say, in the health space. I have a couple of slides just to focus on mostly the data portions. I may go over a few, but just to talk about a little bit about how we do that. So I will say, I think I covered this. I won't talk about just what's changing around us, and if we aren't very thoughtful about positioning issues very carefully, people get run over by them. What I will say is, and this is one I want to challenge all, and I heard a lot of folks in this community today talking about community as if the only community there was low-income folks, which is really interesting. Did y'all catch that? I don't know if y'all caught that. When people in this audience, for the most part, talk about we're going to community to do community engage, I didn't hear very much talk about employers or other nonprofits or the teachers' unions or the trade unions or the hospitals or the health insurers. All of those are part of your community, all of them. right? I didn't hear very much about the people in the rich neighborhoods who maybe don't need services but have a stake in what y'all are talking about. What I want to say about that, and the reason I have these gears moving around, is because every community, for the kinds of solutions that y'all are trying to scale, you need a hell of a lot more folks than the folks who are low income in the room. You need a hell of a lot more folks who are nonprofits. And the challenge for us is we haven't figured out how to get those folks working in alignment together. In order to scale bigger solutions, to get the kind of reach that we want, you got to convince a whole lot of folks, the public agencies, the private agencies, the right? We could go down the list of folks, university partners, right? A whole series of folks need to be working in alignment to make those solutions work. If you got great doulas on staff and you got great folks who are paid to do that, but their employer is making them work in unsafe conditions, guess what? You still have a pregnancy that's going to be at risk. Unless you got some alignment there, an agreement about the well-being of our children in this community and how we show up for our children in this community, right, then you're limited in terms of what the outcomes will be, even for the very programs that we're trying to support. So a part of the work of case making is thinking very carefully about community in a larger sense, and how do you get these folks working in alignment where there's cross-pollination, where folks are on the same page, where the city council and the neighborhoods that are trying to figure out are figuring that out together, right? That's a part of the work. So what I would say to you all as you think about this, Jeremy Himes and Timms wrote a book called New Power. I don't recommend it, it's an awful book, and it's all about social media, but what I do appreciate about what they talk about is the future of our communities is going to be won by the folks who understand how to mobilize folks. The name of the game is mobilization, folks. You can have the best research in the world that shows all the best outcomes, but if you can't mobilize people around the findings, it does not matter, except for the folks who are around that individual table. That's the work of case making, getting folks to see that they have a stake in this situation, whatever it is, who may not have anything to do. They may not live in that community. They may not have any of the social conditions around that are facing that community. They may not even have the chronic disease that you're talking about, but they feel a sense of ownership and stake in what happens. The folks who are going to win the day, who are going to shape every community across New Jersey, are the folks who understand how to build people's participatory energy for the work that y'all are talking about, and that's why this case-making stuff is so important. So what I would say to that, before I get to and I probably will skip through some of this relatively fast because I know I'm off my time track here, is don't let the urgency of the moment force you into trying to solve some of these problems in the wrong way. Because I know y'all are scholars. And the way y'all try to solve problems, you gotta study it, and then you gotta bring your data to it. We gotta throw out more data. It's not the answer. I learned that the hard way. Many of you probably, I started this work out thinking that if I just had enough data, if I just went to graduate school, learned how to do econometric analysis, and I can show the economic benefit to policymakers, right, of the kinds of services that you see happening in communities, if I could just show the impact of that, both the financial return on the investment, but also the social returns, that when you invest in the power and capacity of our communities, right, that we get this return that is so, outsized, that how could this not be a great investment? And I thought, if we could just show the data, man, what? Policymakers would say, oh my God, we've been so silly. We have not been investing in the right places. Yeah, how's that working for us? Because I heard a lot of data in this room that should be absolutely shaping every community across not only New Jersey, but the nation, right? Where many of us can show the cost-benefit analysis. It's not even about just the social returns. We can actually show you're going to save some money, folks. For those folks who only think about monetary gain, we can show that. And yet, I would say things have gotten worse, right, since I first got my PhD, certainly, and we didn't have as much data, right, as they are today when we have so much data. I mean, I think every other week, Raj Shetty comes out with another study showing the long-term effects of, like, we can predict a child that grows up in this community, we can predict the health outcomes, we can predict a whole lot of the economic outcomes, not with a high degree of certainty, but generally speaking, we know if you come from this zip code, we know what it looks like 20 years from now, right? I don't know how much clarity you want in terms of data. What more can we do? So our challenge is, let's not solve the challenges that we have, I think, with the wrong set of tools or by solving the wrong problem. This is not a data problem. It may be a little bit of a framing problem, but I would say the Stanford Social Innovation Review, some of my colleagues a couple years ago wrote this paper, which I continue to think is evergreen, just talking about public awareness. This is not a public awareness problem. You're not telling anybody anything new when you talk about the latest study on affordable housing, which shows that 80%, I think there was a study, 80% of African Americans cannot afford to live in the cities in which they live in today, or 20, like, you're not telling anybody new. And what actually those studies do when they try to build public awareness alone, what they do is they actually backfire, right? They backfire in many ways. Some of those ways they backfire is that you actually get people moving away from the issues, not toward them, in a way that you would expect that they should. Let me give you an example of a backfire, I would say, in the health space. I sometimes use this example because it's a good one. I blotted out the organization's name. So this is an organization that wanted to bring more public awareness to the cost of poverty, when that poverty has a cascading effect on so many different things, on the social and emotional development of children, but a whole series of things that we can predict, right? When you look at a young man today, and you can see that 1 in 5 kids across the country today live in poverty. They experience abuse, neglect, and violent crime, and poor nutrition, other trauma. They suffer from mental health problems and personality disorders and depression, engage in risky behaviors like smoking and sexual activity, do poorly on tests, drop out of school or fail a grade. And they put this out just to bring awareness to that. So I'm gonna put y'all to the test because I know it's hot and I know it's afternoon, so I gotta get y'all engaged, otherwise I'm not sure y'all are with me at all. So let me ask you this, is this a backfire? Right, or is this advance the cost? How many folks would say this is a backfire? Oh boy, we got a lot of work to do, people. For those of you who said this was a backfire, tell me why. Just yell it out. Tell me why that's a backfire. Stereotypes, back in the back, whole lot of problems. I can't fix any of this stuff, right? What else? Hopelessness. I don't know how you're gonna get any aspiration out of this thing, because I'm feeling like I need to go home and have a drink. Right? I'm not excited about that at all. What else? Yeah. Blame it. Yeah. For most folks, when they look at this and they see this young man in peril, they say, well, where's his family? Like, where's his mother? Where's his church? Where's his church home? My mother's a minister. My mother's a minister, so I'll say, where's his church home? Right? Where is his community? Aren't they concerned? And worst of all, folks might say, well, why did the mom have this kid if she wasn't able to? Where have you heard that before? Yeah. I'm tired of all these people having babies they can't. What else? Hello, that data is so unconvincing. 1 in 5 kids, y'all do this a lot in health, but 1 in 5 kids, listen, I'm gonna say something that may be provocative, but I'm telling you, if this was on Fox News tonight, this would be a success story. 4 out of 5 kids in America are doing great. They don't suffer from mental health problems or personality disorders. They don't experience abuse or violent crime. They don't engage in risky behavior and blah, 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 blah. Wow, ain't America great? This is a great place to live. 80% of our kids are doing all right. That data point just went the other way on you, right? What else? Yeah. Yeah. Oh man. No assets. This young man and his family have no assets. Man, it's so negatively framed. You feel sorry for this person and right? Whatever his family is, you have no sense of potentially the joy in his or her family, or what it is they enjoy, or what it is that's going right for them. All you know is something's wrong with this person and whoever is around him, right? Yeah, not an asset-based perspective at all. What else? Yeah. Yeah.
Sorry, did you hear me? I just said some of the things you just cannot fix, or they're really hard to fix. They're unmodifiable. You can't change them.
Absolutely. You can. I'm at home. I'm a mom. I have teenagers. I'm at home. Listen, I'm doing everything I can to just get home, get dinner on the table. And now I open the newspaper or I read this thing, And now I gotta fix what? I gotta fix poverty? I gotta fix mental health? I gotta fix risky, violent crime? Huh? I'm turning the net. I don't know, I don't even know what to do with that, right? And there's nothing on here that helps me understand or be empowered to do anything. What? I'm checking out of that conversation. And the name of the game is, with all the things that people are experiencing in their own lives, people are gonna check out of this conversation so fast it is not even funny, right? What else? I'm looking for one more thing. Yeah, go ahead.
I'm not sure if this is what you're looking for, but it just seems to me that it could be weaponized, right? And so I'm a black woman, that turns me off in how they are positioning my community, my black young men. And so I don't want to deal with them because I want to position them from a strength-based perspective, not perpetuate the deficit focus that's in the literature about them. So to me, this is very dangerous because somebody can get a hold of that and weaponize it and continue to perpetuate the negativity and the disadvantage.
Absolutely, absolutely. One of the things you got to think about, especially from case making, is how do you help people want to be part of the story that you're telling? I don't even want to be part of this story. I don't want to be part of this. Listen, I have 2 teenage boys. I don't want them to be part of this story. This is not the story that I'm building for them, nor the story that I want to expose them to. Right? This is not the reality I want to have. I think you were saying that a little bit about stereotypes, but also the challenge of this, look at the actual photograph. It's an up-close picture of a young African-American man, and under his face is a whole lot of negative stuff. If you want to know how implicit bias gets calcified, you're looking at it. You're looking at it. Now, this is done by folks who genuinely care about this young man. In fact, the whole reason for developing this and a whole series of other posters and things was to try and get folks to see, to be aware, right, of what happens with the cascading, right, effects of poverty. It's not just that you don't have material resources to buy a home, to buy food. It's all the other implications of what happens when you're in that circumstance. That's what they wanted to share. What came out of this, unfortunately, was not, right? It's a backfire on so many levels. I'm gonna do one more. I have a lot of these, but I'm gonna do one more, and then I'm gonna tell you what to do about it. How about that? So this is another one specifically about housing, and it's talking about the it's talking about the racial wealth gap, right? I have lots of friends who are doing issues around the racial wealth gap. I've been very embedded in a movement called the redress movement, which is about how you address, right, historic racial segregation in our communities. And these are just articles. One on the left was Fortune magazine, the one on the right was Forbes, all trying to communicate a story. I love this one. Blacks and Latinos are going to be broke in a few decades. And the story was about the fact that increasingly blacks and Latinos have very little access to home ownership, which is the primary wealth building engine of our nation. If you don't own a home, most people have no other assets. They don't have stocks, bonds, and annuities. They don't have a second home or rental property. They got their house and they got whatever is the value of it. That's it. Without access to that, you got nothing. And then, of course, right, Forbes wanted to show the whole trajectory of folks, black and Latinos being almost near zero and white families being much higher to that. Now, they were just sharing this as public information, public awareness, right? Their goal wasn't to remediate any of this. But what I want to share with you is that this kind of data, right, when you present it in this way, right, well, I should ask you, backfire? I probably gave it away. Backfire or are we on solid ground on this one? How many of you raise your hand and say backfire? Yeah. Oh, that's such a backfire. Because if I'm not black or Latino, I don't know why this story has anything to do with me. In fact, I say, woo, I'm out of that story. That's a shame for the blacks and Latinos. They better figure something out. They better get together and have some community meetings, because that's serious. I feel sorry for them. And people may genuinely actually feel sorry. Like, I really feel sorry for their families. They're not gonna have any wealth at all. That's just such a shame. They better, I really hope they figure that out. But I have no stake in that. I don't see my stake in the conversation. I don't see where I am in that conversation. So what I wanna do, and I've given up quite a lot of time, I want to go back. I was going to show you myth and fact sheets and all that kind of stuff. What I want to share with you is that it takes a strong skill set for us to be able to generate broader public awareness, not just public awareness, but to get people excited, right, about what we're trying to do. So I want to share a framework. I had some examples. I may just share the framework for strategic case analysis, case making, which tries to address a lot of the issues that are what I call impediments to action. So the first, I would say, what you see in the black are the actual principles of strategic case making. Before you start talking about anything, before you start talking about racial, issues of racial equity, before you start talking about all the things your program does and all that, the first thing you got to do is get people to have a sense of stake in what you're talking about. Do you have stake in the conversation? I would say, for myself and for my team, we do a lot of what we call community voice sessions. And so I was glad to hear many people today talking about listening to folks, right? Whether they are low-income families, high-income families, employers, whether they're hospitals or insurers, listening very carefully to what you hear. And one of the first things you're listening for is stake. When you're talking about issues of housing, for example, are people talking about with a sense of me in first person, what I believe in my situation, or are they talking about other folks? Those people over there, or in that neighborhood over in Camden over there, or in that community, they have high issues of chronic disease, and are they talking about it like they have a stake in it or not? Because if they're not talking about it in terms of we or I, there's no stake in it. And the first thing you got to do is get them in the room. You got to get them to have a stake in that conversation by connecting to the things they actually do care about. So you're listening for, and I love the presentation, Matthew, you were talking about the first conversation about listening to folks talk about what they care about, right? And then connecting that back. You got to do that connective tissue first before anything else, because otherwise all the information and data you're presenting doesn't get you anywhere, right? Because they're not even listening. They don't have a stake in it. They're not invested in it. Sometimes I say if they don't see themselves as part of the story, they're not going to lean forward. So there's a whole series of things that we do in strategic case making to help get people in the story, figure out what matters to them, and then connect it back. Here's why you have a stake in this, whether you're an employer, because you're trying to run a business, and here's the challenge with that. You will not be successful in that unless you address these issues that are happening, right? There are employers all over New Jersey right now who are struggling to keep workers in place. Businesses often, especially during the pandemic, were completely closing down because they couldn't get enough workers. That's an opportune moment to say, you have a stake in the health of this community, not just for COVID-19, but over the long term, and let me tell you why. And connect it back so they see a stake in it. The first thing you got to do before anything else is build a stake in it. There are other things too. The second one is you got to get agency and urgency in that conversation. Most of the folks that I'm talking to, whether they're low income or otherwise, don't feel like they have a sense of power. They don't know what their power is. They say, well, I don't have a lot of money. I don't know anything about that. So the part of it is getting people to see their agency in the conversation. The way you do that, and I probably could ask some of you in the room who are really good case makers, you tell me, the way to do that is to talk people back into their power. How many of you have had to talk to community residents and really talk them back into their power? One way to do that is to remind them of when they were able to do extraordinary things in their community or in their family together. Remember that time when it was the snowstorm of, I don't know, it's New Jersey, pick one, snowstorm of yesterday, whatever. Remember that? And nobody could get out, and we all came out of our houses, and we all helped each other, and we all did that. And remember that when downtown they were going to take that park away, and they wanted to build, and we said, no, we wanted to build this. Remember that time when we built the community? Remember that time when we did that? Yeah, well now we need all of that energy really focused on this issue because it's really critical for everybody in this community today. Talking people back into their power when they don't feel like they have a sense of agency is critically important. So when we do our community voice sessions, we're listening. Do people feel empowered on this issue? Or do they feel like they don't have any agency? Because if they don't have agency, you got to get it in there. Otherwise, you're going to lose the room. The last one I'll talk about, and I think I'm going to close it down so that we can have a more generalized conversation, is the third one, which is helping people to address loss aversion. When you're trying to get people to lean forward on a lot of these issues, the first thing that happens, they think about what they're going to lose if they lean forward with you. And housing. You want to put that into my block? Am I going to lose my property values? Are they going to build some high rise? I'm going to lose my view of the park. It's going to bring some people, I don't know. Am I going to lose my parking space? And they literally start making a mental list of all the things they may very well lose because of what it means to lean forward with you. If you don't balance the scales of that, you're going to lose, right? Because they just made a mental list, right? And so they don't lean forward because they're nervous and afraid. They agree we need affordable housing, but they're nervous about what they're going to lose. What I will say to you is that we know in the science of persuasion, loss or the perception of loss is the single dominating force in all of human decision making. People will go to extraordinary means not to lose something, even if it means, right, they don't get a gain. Let me say that again. It is the single dominating force of all of human decision making. If you don't get in front of that. So we listen in those community voice sessions. What are people afraid to lose? What do they think they're losing? And then in the presentation or the conversation, we try and balance that. Well, you think you're going to lose on this. Let me tell you what you're going to lose if you don't, right, help us to build more affordable housing. Let me tell you what's going to happen to this community with the number of people who don't have a place to sleep at night. You ever been to San Francisco? Do you want this, right? Do you see what's happening in our community? Let me tell you what's going to happen if we don't make a way for folks to have a decent place to live. So what I would say, I know there are 10 whole principles in that. There are lots of things to discuss around that. But what I want to share with you as I close out my part of the conversation is it's a skill set that I would say people don't necessarily get in graduate school, but it's one that's really important. It is probably one of the most important but least understood of the skill sets around how we do this work. And I would say it's critical for folks who really believe that there are real solutions around health equity that we have to build support for. If we don't invest our time and energy in learning, right, how to position our work successfully, not just for policymakers, not just for the White House, but for the very folks that we know in community need this, we'll never get folks, right, to lean forward in the ways that we need them to do so, despite having a whole lot of very important data. So I hope that you will join us on the journey. I think on your tables, I have some bookmarks that have more about our work at TheCaseMade and has more about some of the principles. For those of you who are interested, I hope you'll take the time to invest and learn. Thank you so much.
All right, you're taking questions, I guess, right? Okay, good. Well, thank you for your talk. It was very inspiring and helpful. I find in my work, and I have found in my work over the years, that when it's obviously we all agree it's very important to have academics and researchers involved in our community action work, but a lot of times, and it's a huge asset, you know, not debating that, but a lot of times when researchers get involved in community activism or community engagement, there's rightfully so a hesitancy, a wariness of or almost like an allergy to, you know, there's a lot of caution around some of the things you're talking about because they are nervous about declarative statements and pushing people in a certain direction or saying, you know, asking people to engage in agency and taking action. And so I'm just wondering if you could speak a little bit in your experience to like how you've seen that navigated well so that everyone is working to their strengths and moving things in the right direction and not being, you know, pulling in opposite directions because they're worried about like the community group needs to go this way and they need to be in their lane doing that going beyond awareness raising, right? And the researchers are, you know, they can't do that work at least with their, you know, in that capacity when they're doing community engagement research. So how have you seen that work well? And so any tips you have for helping those of us who like bridge that, you know, how to navigate that with our research colleagues?
Yeah, great question. I think so one of the things that's always been a little bit of a challenge is that sort of line between what we're supposed to be able to do as folks in the academy and what's supposed to happen between advocates and activists who are advocating for particular solutions. But it's interesting because, you know, when I listen to the presentations, even just the ones that we heard today, all of the folks were advocating, I think, for particular kinds of solutions. They were just health-focused solutions. I mean, even if we were just to scale the things that y'all are talking about today and get broader public support for that, that would be amazingly helpful. The thing about case making is you can build whatever solution it is you want. You can feed your data to community-based organizations and have them go out and advocate it for it. But if they don't know how to lift it up, right, to get broader support, right, that's the rub. At some point, somebody's got to make a case that gets people excited about, right, whether that's you or somebody else. Somebody's got to make a case that gets people excited about solving the thing and makes people feel like something is really possible, that this could really happen. We could really actually affect change, because right now there's not. So it is a little bit of a dance, and I've seen that done a variety of different ways. Oftentimes we'll have, we'll get, in my firm, we'll get researchers that are just about to publish a report come out to us and say, how should we kind of frame this for more engagement? And we'll talk about that. Get people in, build a bigger story around it, build stake into it at the very top of it. We all of us in New Jersey have a stake in making sure blah, 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 right? And talk to folks. We want to make, if it's affordable housing, you can do just general things like, we want to just make sure that basic things happen, like bands have band leaders, football teams have coaches, right? Classrooms have teachers, coffee shops have baristas, right? I mean, you can go down the list, but none of that happens if we aren't thoughtful about what happens in affordable housing. You aren't saying go after A, B, and C solution unless you just want to, right? But you're saying none of the things that we all care about will happen unless we do something about this, right, and lean forward. So anyway, there's a long way of saying that I think either if you don't feel comfortable yourself as an academic pushing a little bit into those solutions, deeper into the solutions, then partner with other organizations who can take your research and be able to do that. Otherwise, it just doesn't have, right, the power, right, to be leveraged in a broader way for the benefit of other communities across Jersey. Yeah. Other questions? All right. Hearing none. It's hot and it's afternoon, but thank you all for listening.